But you didn't answer my question, which is, what surprised you? Because this introduction that you just gave, you could have given before you started to write this book, because it probably was the motivation for writing the book. Mm-hmm. But in the process of studying all this stuff, what new insights did you gain?
Yeah, so I sort of embedded my answer in what I said is the naivete of people building a product, using machine learning, thinking because it has AI in its name, that it's going to gain adoption, that people are going to buy it and they're going to use it. Look, you have AI in maybe your product, healthcare product. It might help you with a girl in a bar. When you go to sell it to a medical center, you have problems. They're asking you, how much money is this going to make me? How many FTEs do I need to use to implement this product and maintain it on a monthly basis? What we call the total cost of ownership. So what works in the bar doesn't work in the C-suites of pharma companies and medical device companies and medical centers and medical clinics and so forth. So I think the most surprising part, the most surprising learnings were the least surprising learnings, which is even now when you have AI and some of these products have better capabilities than the previous version of digital health products, the question remains the same. How can I afford it? Who's going to pay for it? How do I get people to change how they're doing things? It's a tough slog.
By the way, it works great in the university because students need to learn, and healthcare provides highly motivating problems. And so we can build decision support systems that are really intellectually interesting, even though they may not get adopted. But that's not the point of the university's role.
Well, I've been challenged on this in terms of, actually, there's a chapter in the book about clinical decision support and what are the barriers to adoption. Oftentimes when I was seeing patients, the last piece of information they mentioned to me is how I made the decision. That information is not in any form of digital format, recorded in the electronic health record. How is an AI platform going to use it to help with the decision making?
So I ran a project about 15 years ago where we tried recording the conversation between the doctor and the patient and then extracting that information from the conversation. It was about 15 years too early, given the technology, because we were getting about half the words that were spoken were incorrectly interpreted by the audio to text systems of the era, especially because patients, they come with different accents. They can't pre-train Dragon naturally speaking for you, etc. So those are our challenges. But there might be ways of getting that information.
I mean, it's improving. I think with generative AI, we expect an improving performance of ambient AI and improved clinical documentation. I think it's a great use case for AI, improving, helping doctors document less, automating that. But still, I think even if AI is listening to the conversation and extracting that information, there has to be quality controls in place before that's used to provide the doctor decision support.